Let me ask you about health care. You're going to meet with your caucus later on this afternoon.
Yes.
Do you have a bill right now that would generate the support of 218 members of Congress right now that includes a robust public option, something tied to Medicare reimbursement rates?
We have had, I've said for months, we will have a public option in our legislation, and we have the votes to do that, and we always have. The question now is, what form will it take? And that's, again, let's go back to deficit reduction. A lot of that will be predicated on the numbers that we get from the Congressional Budget Office as to which approach saves the most money, achieves the president's goals of accessible, affordable, quality health care, improve quality, lower cost, expand coverage, retain choice. If you like what you have, you can keep it. And so we have a situation where we have a couple of good options. I don't think we have a bad option in the mix, and members will have to choose among them.
There are a lot of House Democrats who are worried they're in tight races. If they vote for a health care bill that includes a public option, perhaps they could lose in 2010. Are you willing to risk control of the House to get a health care bill that meets your goals?
Well, actually, it isn't. I think there's some people who are not for a health care bill. I don't think the public option is the issue. So you're either for the health care reform or you're not. And I think all the members of Congress are for health care reform, Democrats and Republicans alike. I think on our side, speaking for our side, some of the objections that are to the bill are not necessarily about the public option. It's one thing and another, how it impacts their regions, which they represent, and I respect that. But it's not an issue here of losing an election because you give the consumer a choice. You tell them they're mandated. If they don't have insurance, they're mandated to buy it. And by the way, you have to buy it from the same insurance companies that have been part of the problem all along. This is about saying to that person, to the consumer, you have the freedom to choose that insurance company or the freedom to have another option, which is competitive with that.